Hi, everyone. We are now recording. Welcome. My name is Margot Malachowski, and my pronouns are she, her. I'm an education and outreach coordinator for the network of the National Library of Medicine in Region 7. Region 7 serves Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. Welcome to Region 7 Presents DOCLINE Library Groups and FREESHARE. So Region 7 is hosting, but this webinar is open to everyone. We are recording on Thursday, August 22, 2024, and we will send the recording out to all registrants. Automated closed captioning is available in Zoom. You just click on the CC button, and the recording will be captioned in YouTube. My colleagues, Emily Hamstra from Region 5, Rebecca Brown from the National Training Office, and Erin Latta and Jillian Takamaru from DOCLINE are here with me today. And they will help me with any technical difficulties that we may encounter, and they will also be answering questions in the chat. So please put your questions in the chat, and they'll be answering during the webinar, but also we can review them after I go through the slides and the demonstration. Okay. So before we get into today's topic, a word about who we are. The National Institutes of Health is the nation's leading medical research agency, and the National Library of Medicine is actually an institute at the NIH. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. NLM also produces DOCLINE, which is our focus for today. NNLM is the network of the National Library of Medicine, and we are the outreach program of NLM. The network operates out of 7 regional medical libraries, or RMLs, and the RMLs offer training and funding opportunities to support equal access to biomedical information. And we also support DOCLINE users. I mentioned in my introduction that I work in Region 7, and Emily is in Region 5. Now, today's webinar has a handout. The link was included in your reminder email, and we can also put a drop to the link to the handout in the chat. The handout includes links to find your regional medical library, also contacts for your regional support for DOCLINE, and regionally we can help you with some basic questions and direct you to training and support resources. And we can also help you with the library groups questions, which is today's topic. There's also on the handout, there's links to the NLM help desk for technical assistance or to make suggestions for enhancements to DOCLINE. Those are better questions to go to the help desk. On the handout are links to the DOCLINE manual and to pre-recorded tutorials, little, different things that you will be doing in DOCLINE. There's some little tutorials on a web page at the DOCLINE resources on that web page. And also there's a link on the handout to the Medical Library Association's EFTS program, which we will talk about later. There at the bottom of the handout is a link to email me if you have any questions about FreeShare, which I imagine folks will. So please feel free to email me. But let's move on. So the network of the National Library of Medicine aims to be a welcoming and supportive to all people, regardless of background or identity. So we thank you for helping us create a positive and professional learning environment. The link to our full code of conduct is available at nnlm.gov/about/code-of-conduct. So if you're curious to read our full code of conduct, it's available at that link. Okay, what is DOCLINE? DOCLINE is the National Library of Medicine's Interlibrary Loan, or ILL, request routing system. And the purpose of the system is to provide efficient document delivery service among DOCLINE member libraries. The links to information about DOCLINE, including the manual and and the short how-to tutorials is in today's handout. You'll hear me refer to the handout quite a bit. So I do encourage you to click on that link and download and save a copy of the handout. This webinar will explain the concepts of reciprocal library groups in DOCLINE. We will cover how to find, add, join, or leave a library group. We will review the guidelines for participating in FREESHARE, which is the largest no-cost library group in DOCLINE. And we will review routing table tips for library group placement. All of this information is available in the DOCLINE manual. It is in section 10 in the manual. Now, there is a PDF that's linked in the handout that takes it, the link will take you right to the PDF of the manual. The manual is frequently updated. In fact, it was very recently updated. So I encourage you to bookmark that link rather than download a copy. I know I'm the kind of person that likes to have things in paper, but it's really to your benefit to have the link because you will have access to the most recent update. Library groups are available in DOCLINE to make it easier for group members to route requests to one another without having to individually add and maintain group members in their routing tables. When I do a demonstration and show you how to look for library groups, you'll see that some of these library groups are quite large. And if you had to add the members individually to your routing table, it'd be quite a task. So groups may be formed around a professional association, such as a chapter of the Medical Library Association, or around a medical specialty, such as nursing or pediatrics. Or library groups may focus on a geographical area, such as New York City, or another shared trait, such as federal libraries. Library group members agree to provide each other no-cost or low-cost interlibrary loan fulfillment. New library groups may be added to DOCLINE if the proposed group has at least 10 members. Groups that were in the system prior to October 2018 may have fewer than 10 members. So if you're shopping around for a library group and you see one that has like 6 members or something, that's more than likely a group that existed prior to 2018. We recommend 10 as a good starting place for a new library group. The National Library of Medicine requires one person to be named as the owner for each library group. On this slide are 2 examples of library groups. One example is the Metropolitan Consortium in New York City. This group has 45 members. So again, if you had to add all 45 to your routing table, it'd be a lot of work. And the shared characteristics in this case is that they're all in New York City or Westchester County. So that's a geographical trait. The owner of this library group is Timothy Johnson. The second library group on this slide is FREESHARE, and we will talk more about FREESHARE in a few minutes. There are currently 1,056 members in FREESHARE. Since FREESHARE is such a large group, NNLM is the owner. Previously, Emily in Region 5 was the owner, and now I am the owner. Library group owner is actually a new feature in DOCLINE. Each library group now has an owner field, and it's replacing a contact field. In a future release of DOCLINE, these owners will be able to edit group members, add and delete them. Right now, the best thing to do is to contact your region to help you add or leave a group. So how do you find a library group? You can use the library's search feature to pull up a library group and view the membership. So after I go through my slides for about maybe another 15 minutes, I will go live to show you how to perform this search. When you do a library search, there are 2 library group filters. The first is limit to my library groups. And if this box is checked, the filter will limit results to libraries belonging to the same library group that your library belongs to. If you're in the Metro group, for example, you will filter to those library group members. The second is limit to these library groups. And when you click in the search box underneath the words limit to these library groups, you will pull up an A to Z list of all the library groups that are in DOCLINE. You can select multiple groups in this search box, but if you are curious about the membership of a particular library group, please select one at a time, as this filter will enable you to see all of the library group members together without distinction of who belongs in what group. So again, after I go through my slides, I will show you how this works. Adding a new library group or joining an existing library group or leaving a library group is an administrative task, as I was mentioning, and you will not be able to do this on your own. So please contact your region for assistance, and the link to finding your regional support for DOCLINE is available on today's handout. Now, if you join or leave a library group, please remember to update your automated routing table to reflect that change. Later in the webinar, we will show you how to update your automated routing table. So let's talk about FREESHARE. Members of the library group FREESHARE lend other FREESHARE libraries at no cost or $0 base fee. To participate in FREESHARE, your library must follow these two guidelines. First, you must review your licensing agreements to make sure your library is legally allowed to provide for no-cost lending for interlibrary loan. And second, you must participate in FREESHARE by lending and borrowing in equal measure. This month, we are working on, and it may not happen until next month, but we are working on a FREESHARE renewal form that we will send to all 1,056 members to attest that they can legally share and that they are willing to borrow and lend in equal measure. So if you are a member of FREESHARE, just a heads up that we will be sending out that renewal form in the next month or so. So please contact me with any questions. We're taking questions in the chat during this portion of the webinar. And if you have any questions about your specific circumstances, email me at the link that's included in today's handout, and I'd be more than happy to talk to you about your specific circumstance. To get the best results for cost-effective and efficient borrowing, structure your routing table so that preferred no-cost or low-cost lenders are in the lower numbered cells. Follow this by putting preferred lenders in with higher costs in subsequent cells. Consider the location of your lenders in your routing table in addition to cost, adding libraries in your state or your region in the lower numbered cells, followed by other more remote libraries in the higher numbered cells. On this slide is a sample routing table configuration. In cell 1, local reciprocal arrangements. You may have agreements with nearby libraries to share at low cost or no cost. So you can put these libraries in cell 1. In cell 2, a library group such as FREESHARE or a local library consortium such as a chapter of MLA. Your library must be a member of that library group already before you can add the group to your routing table. And I will demonstrate this when I go live. In cell 3, place in-state universities or large medical centers that have collections that will complement your own collection. In cell 4, selected large collection, low-cost lenders. In cell 5, you could put another library group. In cell 6, alternate coast lenders to help you cover those early morning or those late evening requests since they are operating on a different time zone. There is additional information about routing tables in the DOCLINE manual. Each cell may contain up to 20 libraries and one library group. I know in the configuration I was just talking about, I was suggesting putting library groups in their own cell, and that is a good practice, but you could put 20 libraries and one library group in one cell. That is possible. Individual libraries and libraries in a library group within the same cell are treated equally by the routing algorithm. Libraries are displayed in alphabetical order, but the lender selection is randomized. Routing does not happen alphabetically. There's much more information about the routing algorithm in the manual, so please check the manual if you're curious about how the routing algorithm works. To add a library or a library group to your routing table, log into DOCLINE and select Manage Library. I will demonstrate this when I go live. Scroll to the Borrow Information and expand on the Automated Routing Tables section. You can edit each cell. On this slide is a screen capture of adding a library to cell 1. And as I typed Bay State, where I worked until 2016, the name of the library comes up and I can click on Update Routing Cell to add Bay State Medical Center, where I still have friends working there. I can add that to my routing table. If my library does not belong to a library group, I will not be able to pull up the name of the library group to add to the cell. So you would need to contact your region, and in the future, you could contact the owner of the library group to be added to that group before you will see it as something that you could add to your cell. Then after you join, you'll see the name and you'll be able to update your routing cell. Okay, so before I go live and show you how some of this works, what about EFTS? The Medical Library Association offers an electronic fund transfer system for online billing. This system collects an interlibrary loan charge from a borrowing library on behalf of the lending library and pays it to the lender, less a transaction fee. On today's handout is a link for where you can find out more about the Medical Library Association's EFTS program. Now, this is obviously a very handy way to handle billing for interlibrary loan, and you can choose to route only to EFTS participants if your library is already an EFTS participant. But if you select route only to EFTS, the routing algorithm filters out any lenders that are not EFTS participants, including those in your routing cells and in the library groups, such as FREESHARE that might be in your routing cells. So you will want to consider that. If you use route only to EFTS participants, you will eliminate the chance of receiving free documents from FREESHARE members and other library group members that don't participate in EFTS. Okay, so I am going to shift gears. We're going to do a live demonstration, but maybe I'll take a look at some of the questions while I'm moving around here. I'm going to stop sharing my slides and go to DOCLINE. So does anyone want to say if there's some?
Yeah, we've had a few questions in the chat. So one request when you're doing a demo, Margot, if you could show us where to find the owner of a library group.
Sure.
And there were some questions about licensing agreements. Someone asked if there were any licensing agreements um, that state that you have to have a cost for interlibrary loan.
Yeah, I'm not a licensing agreement expert, and so that's a case where I mean you should take a look at your own licensing agreements and also some of your colleagues who are licensing material might have be a better source of information than I am.
I would say contact your vendors too if you don't know
Hmm.
if that's allowed. And there was a question too about where to find licensing agreements, and you should have those at your library or you can contact your vendors for those. Um, Another question, Margot, was about what in equal measure means in FreeShare.
So yeah,
How would you define that?
yeah, I would say, I mean, it, the the barest definition would be one to one, but obviously that would be a hard thing to measure. But just if you are borrowing, to make sure you are also lending to the best of your ability. Um,
Yeah, you might think of it as effort. Every time someone asks you for an article, you're actively lending, and every time you're requesting to borrow an article, you're getting it.
yeah,
So it won't be a perfect one-to-one, I agree.
right.
Okay,
Okay.
that takes care of the chat for now.
Okay. All right. So, okay. So so here we are at DOCLINE. You can see that I am logged in here. My email address is right here. I'm also an administrator, so I have this drop-down menu here, which you wouldn't see. You will also see this. This is like my administrator account in DocLine, so I don't do any lending or borrowing at all. And so you will see that reflected while I'm doing my live demonstration here. But the first thing we're going to do is filter for library groups. So here we will come to the libraries drop-down menu, and we will search libraries. So this is a general search, which would be very useful for building or updating your routing table. You could search for libraries if you know their libid, institution name, or department name. If you have a library contact, if you know the OCLC symbol or an email address. So you could search for libraries with those fields. As you scroll further down the page, here are where the filters that you can limit. So you could limit to libraries that have print resources available. And here is where you would limit to those EFTS participants. You can limit to libraries with 100 holdings or more. You can also limit to libraries that do rush or urgent patient care service. So rush means the borrower needs it today. Urgent patient care means the borrower needs it right now. And so there are some libraries that have identified themselves as capable of responding to those service requests. Now, you may have a maximum base fee if you wanted to filter to libraries that would meet your needs that way. There are additional filters regionally, state, city, country, and also lending days, delivery methods, etc. Now here on this side of the web page are the limits to library groups. So if I click on limit to my library groups, and then I scroll down to the bottom of the web page and hit search, I'm just in a group by myself because I don't really operate in DocLine the way you do. So I'm all by myself. I'm in a group by myself. But if I was in another library group, you would see the other groups listed. Now, if I want to change my filtering, I don't have to go back to that page, that previous page. I can scroll down here and oops, I scrolled too far. I'm going to uncheck limit to my library groups. And here is where you get the A to Z list of all of the library groups that are in DocLine. Now, I know Connecticut has a chapter of MLA, and they have a library group in here, Castle. And so if I want to see that membership, I can click Update Search. And there are 20 libraries. So these are all Connecticut libraries that belong in a chapter group. Now I'm going to uncheck that. Another large library group is, oops, the Basic Health Sciences Library Network. And if I click on that, you will see there are 231. So again, a very large group. You certainly wouldn't want to have to add all of those to your routing table. And you can see many of the Connecticut libraries are members of that. But if I added, you can search, oops, that's not the one I was going to add. If I was going to add the Metro one. So I can search on multiple library groups at once, but when I update search, now I went from 231 to 250, but they're all mixed up together. So there's no distinction of which were in the Metro and which were in the Basic Health Science Libraries Network. So before I move on to, and I can check for questions too later, but were there any questions about searching? Oh, somebody wanted to know. Now, this is a question. I'm not sure um, how to look at the owner. If Erin or Jillian have an idea, I can do it through my administration. Look at the owner field. Are regular owner users able to search a particular library group for
This
the
is an
owner?
interesting point. We are going to discuss this at our next DOCLINE team meeting.
Okay.
So,
Okay.
thank you.
Yeah. Good question, whoever asked. Okay. So, um, switching gears to looking at the routing table. So here you go to the library drop down and manage libraries. And down here under borrow information is the automated routing table. And we expand that, and you can see I have nothing in any of the cells. And now to edit my cells, I click on routing table management. And here you can see all my empty cells, and I will choose cell 1. I have to say, this is so easy to do. So again, I will pick Bay State Medical Center where I worked for 8 years. And then I actually, some library groups have disbanded. And so I know this one from Rhode Island has disbanded, but I've kept it for, demonstration purposes. So if I did select this, it would only show up if you were a member and update routing cell. And now you will see that they are now in your routing cell. Now, if you've decided you've made a mistake or if a library sadly has closed, you can edit very easily as well. You just X out and then we'll just return this to the dashes and update routing cell, and that's it for. So if you leave a library group or if you're added to a library group, you'll want to get in here and update your table. Okay, so while I am in DOCLINE, does anybody have any questions? Okay, I'm going to stop sharing so I can see what's been happening in the chat. Okay.
Chat's busy, so I'm
Yes.
keeping up here. Is there a way to refresh routing tables? Or what's the easiest way to refresh routing tables?
Um, I might be get confused about so you can go through your routing tables and edit them. Does that answer the question? You are able to get in there in any time to, or are you, I guess I'm confused by the question.
Sharon, let us know if that doesn't answer your question.
Yeah.
Do updates to the routing table need to be approved?
No, those are decisions that you are making for your library, and they don't need any other approval.
Here's a question about library groups. So becoming a member of a group requires administrative work by a DOCLINE coordinator, correct?
Correct. So right now, you would contact your regional coordinator. Um, in a future release, you would be able to contact the library group owner, but we have just identified that there's no easy way for you to get that information right now. So the short answer is contact your regional coordinator.
And we also have a comment that if you have a library in a higher number cell and you want to move it to a lower number cell or vice versa, you have to first delete it entirely because the library can't be in two cells.
Okay.
This is cumbersome.
Mhm.
And it would be great if it would just let you confirm that you want to move it to a new cell. So
Okay. So
noted.
that, yes, and that would be a great suggestion to put to NLM help, because they are always looking for ways, for upgrades that could make it easier. Um,
Yeah, thank you for the feedback. We'll be discussing this one as well.
yeah.
There are a few more questions about groups. So one question is it correct that everyone in a group does not have the same fee or no fee policy? And I think that really depends on the group, doesn't it, Margot?
Yeah, and groups have gone through a lot of changes. I see Cheryl's comment here that the the Rhode Island group is now SIG under the North Atlantic group, but they have decided not to be a library. So they're still in existence, but they're not a library group within DOCLINE. And so there's been a lot of changes within groups, certainly with, library closures or consolidations of hospital systems. There's a lot of change. So if particularly the kind of the easier thing to do is if you're associated with like a chapter of MLA, or in New York, they have these whole other councils if systems that have groups in DOCLINE. So to get in touch with those groups and find out how they operate and what their fee structures are. And
So we have
yeah.
another question of the group Metro is a free group, and I just took a look at that group in DOCLINE, and there aren't lending notes for that group. So I'm not
Yeah.
sure if that's a free group or not.
Yeah, so that's one of the New York councils.
Okay.
So you would have to get in touch with them. And to if you have any particular question, you can, email me and I can let you know what the details. New York has all sorts of, yes, Chris has mentioned Metro requires membership in their council. Yeah.
There's a question here about regional support, so I'm going to drop that link in the chat. So each regional medical library has someone on staff who provides DOCLINE support. And if we can't answer the question, then we level it up to NLM, to their help desk. So Erin and Jillian help us out on the NLM side with questions as well. But that nlm.gov/about/docline in the chat will help you connect with your regional coordinator.
So yes, if you're here today and you're in Region 7, it's me. And if you're in Region 5, it's Emily. We do have 5 other people.
So a question about new groups. Can we create new groups in DOCLINE?
Yes, so if you would contact your regional coordinator, and again, we recommend 10 because it's really to, well, not only is the low cost, or if you're able to do no cost function a part of it, but also the idea of not, of doing it easily within your routing table. So we do recommend 10 as a starting place.
And there's a comment that back in the day, a lot of these regional groups were set up because it was faster to mail physical copies of the articles. So a lot of these groups are long-standing.
Yes. And certainly interlibrary loan was a key function in some of the chapters too.
Another comment that it would be helpful to be able to search for libraries by state or by city in DOCLINE. Thanks for
Yes.
that comment.
Yeah. So you can search by state or city. So let me share that again. So if you do the library's search, and so I am going to search by Massachusetts. Now, I will point out that the default is any. So I want to say I want them to be a participant in DOCLINE. NLM only means that they are only borrowing materials from the National Library of Medicine, so they are not lending. So if I am looking for a library that will lend to me, I want to put in participant. And I also, this is defaulted to any, I want to make sure the library is open. You could further limit by library type, but in this case, I will just leave it at any, and now I'll hit search. So now I'm finding 49 libraries that are open and participants in Massachusetts. So this is and here, once you're here, you see the contact email and contact telephone, and what town or city they're located in. So if you are looking to refresh your routing table, this would be a good place to, you can, kind of poke around. Okay, see if there's, okay, I see a comment that there was the ability to search by city and state. Um, I'll go back to Massachusetts. Oh, I have to pick a state. I mean, a city, Boston. And I don't know if can I choose more than one? I've never tried this before. Nope. So if I choose Springfield, then I'm going to get the 3, Springfield, Massachusetts. Okay, and I do see Ellen's comment about we do hear this frequently about the operating hours. So it's definitely been heard. I think there's some technical challenges to pulling that off, but
That's exactly right,
yeah,
Margo.
yeah.
Yes, we do want to do that, but indeed it is because it entails all of the routing system, which is, kind of the big thing in the drive stock line. So it's a little complicated, but yes, we know that that would be nice to be able to start by open hours. It's definitely on the list.
So Erin, remind me, there's a question about the embargoed articles. I
Let me see.
see.
Sorry, I was focused on that.
Yeah.
Rejecting. It's always up to the library, how they indicate when they reject a request. It's certainly up to you how you do. Um, let's see. Let me.
I know there is something about people getting requests for articles that are embargoed, and
Oh, is that the
it
question?
has to
I'm
be
sorry.
yeah, it has to be there has there's a qualifying thing
Oh, okay. Let me check.
that I don't recall the full answer to it, but I do hear about it. Um, I know
Oh,
there's
yeah.
yeah.
Embargo is another one of those large scale issues that we absolutely know that we have to tackle. The problem with embargoes is hard to explain, but it has to do with how the citation information is read in journal holdings. So it's something that we have to work on trying to figure out how exactly to handle those because embargo periods move, and they're tricky to pin down. But in terms of what reason you should select, it's again up to the library. But there is a, a good list of reasons.
And Shannon, you don't have to ask permission to add libraries to your routing table. That's all up to you. Folks are in there, and once once your library is in there, they're available to be added to your routing table. Okay, well, I think if I haven't, if we haven't caught your question, I'm going to put my email address in the chat. Chesky. And also my email is on today's handout. And we do have a okay. All right. Well, thank you all for joining us today. We had a nice large group. So I was I'm going to stop the recording and thank you all for coming.